All right, let's jump right in. You guys sent us some pretty intense stuff this time around. A whole bunch of articles and data all about the U.S. healthcare system. And it seems like the overall theme is troubles brewing, right?
Things are getting a little heated, for sure.
Yeah.
It's not just rising costs or political stuff anymore. It's like there's this surge of...
Raw emotion, right?
Yeah, raw emotion, like frustration and fear and even anger.
Yeah.
Like directed at the system itself.
It's like the whole system is on trial now.
Yeah.
And it's interesting, the Insight article by Michael D. Kleinberg.
Yeah, at Mesh Digital.
At Mesh Digital calls this the boiling point, which I think is a really apt description. And then you look at some of these stories in the BBC article, people's personal experiences, and it's just...
Heartbreaking.
This one about a stage 4 cancer patient.
Yeah.
Who's basically battling their insurance company just to get medication approved.
Yeah.
Infuriating.
That's a perfect example of why this whole total member experience thing, TX.
Yeah.
It's more than just a buzzword now.
Right.
It's really about addressing these fundamental problems in the system.
Yeah, it feels like.
That are causing people to just lose trust.
A complete loss of faith in the system, which is kind of scary. So you mentioned the boiling point, and that Kleinberg article really doesn't shy away from the strong emotions that people are feeling.
Nope.
It actually opens with a pretty shocking event, the murder of United Healthcare CEO Brian Thompson.
Yeah, tragic event. And it's important to say up front, violence is never the answer.
Of course.
But those shell casings, you know, the ones inscribed with the deny, defend, depose.
Chilling.
It's chilling because it just speaks to those very criticisms that are being leveled at insurance companies.
Yeah, it's like the killer took all those common complaints you hear. Denied claims, legal battles, that since their profits come before patients, and just turned it into this horrific act.
It's an extreme outlier, of course.
Absolutely.
But it is a stark reminder of how real this anger is.
Right.
I mean, the Boston Consulting Group did a survey and found that 2/3 of Americans blame insurance companies for these high costs.
Wow.
And they feel like they're putting profits over well-being.
That's
not a fringe group.
Yeah, that's a huge chunk of the population.
Yeah.
So we've got to ask ourselves, what are the specifics fueling this anger?
Yeah.
I think denied care is a huge one.
Absolutely.
The prior authorization system, in theory, it's meant to curb unnecessary spending, but it often feels like it just
backfires,
delays or denies crucial treatments.
It creates more problems.
Yeah, the BBC article, again, full of these stories.
Oh, it's heartbreaking.
Like one woman describes it as begging for her life, trying to get her rheumatoid arthritis medication covered.
It's not like these are experimental treatments either.
Right, we're talking about basic, necessary care. It's just mind-boggling.
Yeah.
And then on top of that, you've got the cost transparency issue.
Oh, yeah. Huge one.
The delayed study found that over half of Americans are confused about their health benefits.
It's like it's too dark.
It's a guessing game. Like you're playing a guessing game with your own health.
You never know what anything's going to cost until
that bill hits.
Yeah.
Oof. And those bills can be devastating.
Yeah, the U.S. is unique in that we spend the most
on healthcare.
On healthcare in the world.
Yeah.
But we don't get the best results.
We're not getting the best outcomes.
Yeah.
It just doesn't add up.
Yeah, and then we're facing this medical debt crisis that you don't see in other wealthy nations.
Unheard of.
Yeah, the Commonwealth Fund has done some research on that.
Yeah, it's like we're paying more, getting less, and drowning in debt.
That's a recipe for...
No wonder people are furious.
Yeah.
The Kleinberg article argues that all this, the anger, the erosion of trust, it's creating a really dangerous situation.
Yeah, dangerous for everyone involved.
Yeah. For both patients and the healthcare industry.
It's just not sustainable.
Right.
If these insurance companies want to survive, they need to rethink their entire approach.
Yeah, like fundamentally change how they operate.
That's where this whole total member experience thing comes in.
TX.
Yeah.
So it's not just a Band-Aid fix. It's more like a complete...
It's an overhaul
of the system
yeah.
and the priorities, which is a big ask.
That's a big ask.
Yeah. So if I'm understanding this right, TX is less about specific policies. And more about a philosophy shift. Like the Kleinberg article uses the term human-centered.
That's it, yeah.
Which is...
It's about remembering that this isn't just transactions and data points. This is real people.
It's people's lives.
Yeah.
Struggles.
Real situations.
Complex, often scary situations.
Yeah.
Their needs have to be at the center.
So their needs, their experiences, their emotions.
All of it.
Yeah. Okay,
it's a big shift.
Yeah.
Lovely in theory, But how does this actually work?
It's a great question.
Like, what does a human-centered healthcare system look like in practice?
Well, think about the best customer service experience you've ever had. Maybe a favorite store, a tech company you probably felt listened to, understood, maybe even cared about.
Yeah.
That's the feeling TX is going for.
But applied to something as important as your health.
Exactly.
Okay. So we're not just talking about friendlier phone reps here.
No.
This is a much deeper change.
This is a...
Right.
Yeah.
The Kleinberg article lays out a comprehensive approach, actually drawing inspiration from other industries.
Yeah, they've kind of cracked the code on customer experience.
Who are we talking about?
Think like personalized recommendations, the kind you get from Netflix.
Okay.
The ease of use of, say, a banking app.
Okay.
But for managing your health.
Okay, so bringing that kind of seamless user experience to healthcare.
Exactly.
Okay, I'm starting to see the potential here.
Yeah.
But before we get into the nuts and bolts of how TX is actually implemented, let's just take a step back for a second.
Okay.
That CEO murder, the anger, the distrust.
Yeah.
It paints a pretty bleak picture.
It does.
Is there any hope for the U.S. healthcare system?
I think there's tons of hope.
Okay.
I think cynicism is easy.
Right.
But the fact that people are this angry means they still care.
Okay.
They haven't given up on the system. They want it to work.
So it's not about throwing the baby out with the bathwater.
Exactly.
It's about saying, okay, this is broken.
Right.
We need to fix it.
We can fix it.
Yeah. So less doom and gloom.
Less doom and gloom.
More roll up our sleeves attitude.
Exactly.
Yeah, and it feels like that Kleinberg article really captures that, right?
It does. It's not just a diagnosis. It's a roadmap.
Yeah.
It acknowledges these huge challenges.
Right.
But it gives practical steps that insurance companies can take. Okay,
so it's about solutions, not just complaints.
Yeah, drawing inspiration from those industries that have figured this out.
So we've got models to work from.
Exactly.
That's encouraging. So let's get into those specifics, those nitty-gritty examples of how other industries are getting this right. How can we take those lessons and apply them to healthcare?
Well, think about that personalization you experience with Amazon or Netflix, right?
Okay, yeah.
They're using data
to recommend stuff.
Yeah, to recommend products or shows that you might like.
Based on what you've done in the past.
Based on your past behavior.
Right.
So now imagine that applied to healthcare.
Okay, so instead of just generic health advice, I'm getting stuff that's tailored to...
Tailored to you.
My needs and my risks.
Right, your specific needs and risks.
Okay.
Let's say you're a member of a health plan and your medical history suggests you might be at risk for diabetes.
Okay.
Now, instead of sending you a pamphlet, your insurer could use AI to analyze your data, your age, your lifestyle, even your location, and create a personalized wellness plan just for you.
So there's like a concierge
Service for my health?
It's getting away from that one-size-fits-all approach.
Okay, I like that.
And moving towards something much more personalized and targeted.
Okay, so what would this actually look like? Like, what would be in this personalized plan?
Well, it could include targeted information about nutrition and exercise tailored to your preferences.
Okay.
Connections to local fitness programs or support groups.
Okay.
Maybe even virtual coaching sessions with, say, a certified diabetes educator.
Wow.
And all of this accessible through an app that's easy to use.
So it's combining like the power of data with human support.
Exactly.
And meeting people where they are.
Yeah.
Yeah, and empowering them to actually take control of their own health.
Absolutely.
Which is something that's often missing, right?
Absolutely.
I can see how that would build trust and motivation.
And there are studies showing that these personalized interventions really work.
Oh, okay.
Like they can significantly increase how much people stick to their healthy habits. Okay, so adherence is better.
Adherence is better, which leads to better outcomes and reduced healthcare costs in the long run.
So it's a win-win.
It's a win-win for everybody.
That's fantastic. Okay, speaking of wins, let's talk about customer service. That's one area where I think the healthcare industry has, to put it mildly, room for improvement.
Room for improvement, yeah.
Can TX really fix the nightmare that is dealing with insurance companies?
It can. It can.
Okay.
And some insurers are really making progress on this.
Okay.
AI-powered chatbots are becoming more and more common.
So I can get my questions answered by a bot instead of being stuck on hold for an hour.
Yeah, exactly.
Okay, I mean, it's a start.
It's a start.
But how good are these chatbots, really?
They're getting really good.
Okay.
I mean, they can understand natural language.
Wow.
They can access your information, give you tailored responses.
Oh, okay.
They can even help you through the claims process.
Oh, wow.
Help you find a doctor.
Okay, so it's not just replacing humans.
It's about freeing up those human reps.
To handle the tougher stuff.
The complex stuff.
Yeah, that requires more.
Yeah, the problem solving, the empathy.
The human touch, right.
Exactly.
Yeah.
It's about using technology strategically.
To make things better for everybody.
Yeah, and some companies are using AI to analyze all those interactions.
Okay, wait, like call transcripts. Whole transcripts, social media posts.
Social media, all of it.
To figure out what's frustrating people.
Yeah, to figure out the pain points.
Okay, isn't that a little Big Brother-ish?
It can be if it's not done ethically and transparently.
Okay.
But the goal here isn't surveillance, it's understanding.
Okay.
It's about finding those patterns.
Right.
Maybe there's confusing language in a letter.
Right.
Or the website's just too hard to use.
Yeah.
And then fixing those problems.
So they're not just reacting to complaints, they're being proactive.
Exactly.
Okay, I can get on board with that.
It's a shift from reactive to proactive.
Yeah, and it's not just about tech. Right?
No, it's not.
The Kleinberg article really emphasizes
the training.
Employee training.
Employee development.
You can have the fanciest app.
Yeah, all the bells and whistles.
But if the people aren't empathetic and knowledgeable,
it's not going to work.
It's not going to work.
Sure.
So it seems like a lot of this boils down to a cultural shift within these organizations.
Yeah.
Can you really teach empathy? Can you really change a company's DNA?
It's tough. It's really challenging.
Yeah.
It's not about putting on a friendly face. It's about...
It's got to be genuine.
Yeah, it's got to be genuine.
Yeah.
It's about how these organizations operate, how they see their members.
So it's deep transformation.
Yeah, it's not a quick fix.
Not just a few tweaks here and there. It's like a whole fundamental shift.
Yeah.
But can they afford it?
That's a great question.
I mean, healthcare is already so expensive.
It is.
Wouldn't all this human-centered stuff just add more costs?
Well, that's what's interesting. Research is showing that investing in TX can actually lead to savings.
So it's not just the right thing to do, it's the smart thing to do. Exactly.
Does that work? When you improve patient engagement, you prevent unnecessary care through those personalized interventions we talked about.
Right.
And you streamline those administrative processes. All of that can help reduce spending overall.
So being nice to patients can actually save money.
It's not just about being nice. It's about creating a system where people feel empowered and supported to make healthier choices. And there's a study by Bain & Company.
Yeah.
They found that payers who invest in these member-centric models can achieve a 15 to 20% reduction in medical costs.
15 to 20%.
Over a 3-year period.
Wow, that's significant.
It is.
So the initial investment can actually pay for itself.
Over time, yeah.
That's a pretty powerful argument for change.
It is.
Yeah. And beyond the financial benefits, there's also the reputational stuff to consider.
Absolutely.
In a world where consumers have so many choices.
Yeah, they have options.
Healthcare organizations that prioritize TX.
Yeah.
They can really set themselves apart.
They can differentiate themselves,
Attract and retain members, build a stronger brand.
Absolutely.
It makes sense. People are more likely to stick with a health plan that they trust.
Exactly.
Even if it's not the cheapest option.
Yeah.
It's like choosing a restaurant. Good food is important,
but so is the atmosphere.
The service matters.
The service matters.
Yeah, and that trust, it can translate into better outcomes, too.
Absolutely.
And patients feel heard and understood.
Yeah, they're more likely to follow their doctor's recommendations.
To take their meds, to engage in healthy behaviors.
Exactly.
So it's this virtuous cycle, right?
Yeah.
Better experiences lead to better outcomes, which lead to lower costs and a healthier population overall.
It's a win-win-win.
Okay, but let's be real for a second.
Okay.
This is a massive undertaking.
It is.
Are there any organizations out there that are actually doing this well?
Oh, yeah.
Like, who are the TX rock stars that we can learn from?
There are. Oh, yeah. There are some real standouts out there.
Yeah.
Leading the charge,
Okay, give me some names. Who are we talking about?
One that always comes up is Kaiser Permanente.
Okay, Kaiser.
They've gotten a lot of praise for their integrated care model and how committed they are to putting the member first.
Okay, but what does that actually look like? Like in real life?
Yeah.
What are they doing differently?
Well, for one, they've invested a ton in technology. But not just for the sake of it.
Right.
Their My Health Manager platform is a good example.
Okay.
It's kind of a one-stop shop for members.
Okay.
They can access their medical records, schedule appointments, communicate with their care team, refill prescriptions.
All in one place.
All in one easy-to-use app.
So it's like bringing that convenience we're used to from other parts of our lives.
Exactly.
Like banking or shopping to healthcare, which is
huge.
A big deal.
Yeah.
Especially when you're already stressed.
Absolutely.
Dealing with a complex system.
Yeah, it simplifies things.
And Kaiser's not just resting on their laurels.
No, they're constantly innovating, adding new features.
Based on feedback.
Based on feedback from members. They were also early adopters of telehealth.
Right, which has become so essential.
Absolutely essential for accessibility.
Okay, so tech is a big part of their strategy.
It is.
But it's not the whole story, right? The Kleinberg article makes it clear that TX has to go beyond just fancy tools.
Oh, absolutely. It's about the whole culture.
Yeah.
Kaiser has really fostered this culture of member centricity.
Okay.
Throughout the entire organization.
So it's not just lip service.
No, it's ingrained.
It's how they operate.
Yeah. Their employees are trained to be proactive.
Okay.
Empathetic and truly responsive to the members' needs.
Okay, so it's one thing to say you're member-focused.
Right.
It's another to actually empower your staff to act that way.
Yeah, you got to walk the walk.
Yeah. Are there any examples of, like, smaller organizations doing TX well?
There are.
Because it seems like something that would require massive resources.
You'd think so, right?
Yeah.
But there are some really innovative, smaller players out there.
Okay.
City Block Health is a great example.
Okay, I've heard of them.
They're focused on providing care to underserved populations.
Okay.
Specifically those on Medicaid or with complex needs.
So they're targeting the folks who often fall through the cracks.
Exactly. The ones who need it the most.
Yeah.
And their whole model is built on these TX principles.
Okay, so how does that play out?
They emphasize building deep relationships with their members.
Okay.
They have personalized care plans. They offer community-based support.
Wow.
They even do home visits when needed.
That's amazing. That level of personalized attention is...
It's pretty incredible.
Yeah.
It's about meeting people where they are.
And recognizing that health isn't just about medical conditions.
Exactly.
It's about the whole person.
It's about their social situation, economic factors.
Their environment, their support system.
All of it. All of it plays a role.
It's nice to see organizations actually acknowledging that.
It's a shift, for sure.
Yeah. But I imagine there's still some big hurdles to overcome.
Oh, yeah, for sure.
The Kleinberg article talks about data interoperability as a major one.
Right.
Can you explain what that is and why it's so important for TX?
Sure. So right now you've got all this healthcare data scattered across different systems, right?
Different systems, yeah.
Electronic health records, claims data, patient portals.
It's all over the place.
It's fragmented. It's like a puzzle that's all mixed up.
So even if an organization wants to be member-centric, they might not even have all the pieces.
They might not have the full picture.
To understand that members' needs and experiences.
Exactly. They're working with a limited view.
Right.
Which makes it really hard to identify pain points.
To personalize care.
To personalize care, to measure the impact of those TX initiatives.
So better data sharing is crucial for TX to really take off.
It's essential. The good news is there's some progress being made.
Oh.
The government is pushing for more data sharing between healthcare systems.
Okay.
And tech companies are developing solutions to help integrate all this information.
That's promising.
Yeah.
What other challenges do you see on the horizon for TX?
Well, one that keeps coming up is the healthcare workforce shortage.
Right. We're just not training enough people.
You don't have enough doctors, nurses, other professionals
to meet the demand.
To meet the demand, which is only growing.
Yeah, and TX, with its emphasis on personalized care and building relationships, that requires a lot of people.
It does. It requires a lot of human power.
So it's kind of a catch-22, right?
It is, yeah.
We need TX to create a better healthcare system.
More sustainable, more humane.
But we also need more healthcare workers to actually make TX work.
That's the challenge.
So how do we solve that?
Well, it's going to require a multifaceted approach.
Yeah.
We need to invest more in education and training.
Yeah.
We need to improve working conditions to prevent burnout.
Right, make it a more appealing profession.
Yeah, and we need to foster a culture that truly values empathy and compassion.
Yeah, starting from the ground up, it's a big ask.
Yeah.
It's clear that there's a lot of work to be done.
There is.
But the potential of TX, it's just undeniable.
It's huge.
Feels like a paradigm shift.
It is.
A move away from this transactional cold system.
Yeah, towards something more human.
Towards one that's actually focused on human beings.
That's the goal.
Yeah. This deep dive has been really eye-opening.
It's been great talking about this.
Yeah, it's given me a lot to think about. And I hope it's done the same for you, our listener. But it's not just about what organizations do, right? Individuals have a role to play, too.
Absolutely.
What can our listeners do to advocate for a more human-centered healthcare experience?
I think the most important thing is to be an active participant in your own care. Ask questions, express your concerns.
Don't be afraid to speak up.
Don't be afraid to speak up. If you feel unheard, say something.
Knowledge is power.
Knowledge is power, and you are your own best advocate.
So it's not about just passively accepting whatever the system throws at you.
Nope.
It's about demanding better.
Demanding better for yourself.
For yourself and for others.
And for others.
Yeah. Don't underestimate the power of your voice.
Exactly.
Share your experiences, the good and the bad.
Yeah, with your providers, your insurance company.
Your elected officials.
Even your elected officials. The more we talk about this, the more pressure we put on those in power to make a change.
So it's about raising the bar for everybody.
Exactly.
So choose health plans that prioritize TX.
Yeah.
Support organizations that are doing it right.
Leading the way.
And advocate for policies that align with these values.
It's a collective effort.
Yeah. It takes all of it. At the end of the day, TX is about recognizing that inherent dignity of every person who interacts with the healthcare system.
It's about treating people, not just patients.
It's about creating a system that's worthy of that dignity.
Well said.
Thank you for this incredibly insightful deep dive.
It's been a pleasure.
It's given me a lot to think about, and I hope it's done the same for you, our listener. Until next time, keep asking questions, keep pushing for better, and keep the conversation going.
There are a few out there doing some really impressive stuff.
Okay, so who are we talking about? Who are the TX all-stars we should be paying attention to?
Well, Kaiser Permanente is one that always comes up.
Kaiser, yeah, I've heard of them.
They get a lot of praise for their integrated care model and their focus on really putting the member first.
Okay, that sounds good on paper, but what does that actually look like in practice? Like, what are they doing that's so different?
Well, one thing is they've invested heavily in technology, but not just for the sake of it.
Right, not just shiny new toys.
Exactly. It's got to have a purpose. Their My Health Manager platform is a good example.
Okay, tell me more about that.
It's kind of like a one-stop shop for members.
Yeah.
You can access your medical records, schedule appointments, communicate with your care team, refill prescriptions.
All in one place.
All in one easy-to-use app.
So it's like taking that convenience we're all used to in other parts of our lives, like banking or online shopping.
Exactly.
And bringing it to healthcare.
Exactly.
Yeah.
Which can be a huge relief for people who are already dealing with a complicated system.
Absolutely. Especially when you're feeling stressed and overwhelmed.
Yeah, it just simplifies things. And the best part is Kaiser's not stopping there.
They're constantly improving.
They're always innovating, adding new features based on feedback from their members.
So they're actually listening to what people want.
Yeah, they're really trying to make it work for the people who are actually using it. They were also one of the first to embrace telehealth.
Right, which has been such a game changer, especially in terms of accessibility.
Huge for accessibility.
Okay, so tech is clearly a big part of their strategy.
Yeah, it's a big part. But it's not the whole story, right?
Right. The Kleinberg article is very clear about that TX can't just be about fancy tools.
It's about a mindset shift.
Yeah, a cultural shift within these organizations.
Yeah, and Kaiser really seems to have cultivated that culture of member centricity.
Okay, but that's a big organization with a lot of resources.
Right.
Are there any smaller organizations that are successfully implementing TX?
Oh, there are, definitely. And they're doing some really creative things.
Okay, I'm all ears.
CityBlock Health is one that comes to mind.
CityBlock Health, okay.
They're focused on providing care to underserved populations.
Okay.
Specifically people on Medicaid or with complex needs.
So the folks who are often overlooked or marginalized by the traditional system?
Exactly. The ones who need it most.
Yeah, those folks often fall through the cracks.
So how does CityBlock approach TX?
Their whole model is built around those TX principles.
Okay. So what does that look like?
Well, they really emphasize building those deep relationships with their members.
Okay, so it's about connection. It's about connection. It's about understanding each person's unique needs.
Right.
They create personalized care plans. They offer community-based support.
So it's not just about medical care. It's about the whole person.
The whole person, exactly. And they even do home visits when needed.
That's incredible. That level of personalized attention is really impressive.
It is. They go above and beyond to meet people where they are.
I love that.
Yeah.
It's so refreshing to see organizations recognizing that health isn't just about treating symptoms.
Right. It's not just about pills and procedures.
It's about addressing the social, economic, environmental factors that all contribute to a person's well-being.
It's about the whole picture.
Yeah. But I imagine there's still some major hurdles to overcome.
Oh, for sure.
The Kleinberg article mentioned data interoperability as a big one.
Right.
What does that mean, and why is it so important for TX?
It's a big one. So imagine this. Right now, all this healthcare data is scattered across all these different systems.
Yeah.
You've got electronic health records, claims data, patient portals.
Yeah, it's all over the place.
It's fragmented. It's like a puzzle with all the pieces jumbled up.
And that makes it difficult to see the full picture.
Exactly. So even if an organization wants to be member-centric, they might not even have all the information they need to understand that members' needs and experiences.
So they're working with a limited view.
Very limited.
Yeah.
Which makes it that much harder to identify those pain points, personalize care, and really measure how well those TX initiatives are working.
So better data sharing is crucial if TX is going to really take off.
It's absolutely essential.
Yeah.
Thankfully, there's some progress being made on that front.
Oh, it's good to hear.
The government is pushing for more data sharing between healthcare systems.
Okay.
And tech companies are stepping up to develop solutions to help integrate all this information.
Okay, so there's hope for a more connected future.
There is, definitely. But data isn't the only challenge.
Right. What else are we up against?
Another big one that keeps coming up is the healthcare workforce shortage.
Right. We've been talking about this for years.
It's a chronic problem. We just don't have enough doctors, nurses, and other professionals.
To meet the demand.
Yeah, the demand is only growing. And TX, with its focus on personalized care and relationship building, that requires a lot of manpower.
Yeah, it requires a lot of human touch.
It does. And we just don't have enough hands on deck.
So it's like this catch-22. We need TX to create a more sustainable, more humane healthcare system.
Right.
But we also need more healthcare workers to make TX actually work.
Exactly. That's the big challenge.
So how do we solve that? It seems like a pretty daunting task.
It's going to take a multifaceted approach.
Right.
We need to invest more in education and training. We need to make healthcare a more appealing profession.
Right. Improve working conditions, reduce burnout.
Exactly. And maybe most importantly, we need to foster a culture that values empathy and compassion in healthcare.
Yeah, a culture that prioritizes the human element. A big ask.
It is. But it's essential if we want to create a healthcare system that truly cares for people.
This deep dive has really opened my eyes to the possibilities of TX.
It's exciting stuff.
It feels like a paradigm shift.
It is.
A move away from this cold, transactional system to one that's truly focused on people as human beings.
That's the goal.
And it's inspiring to see so many organizations and individuals working to make that vision a reality.
It's happening. It's gaining momentum.
This conversation has given me a lot to think about, and I hope it's done the same for you, our listener.